All right, guys, welcome. So I wanted to do this video because I thought it was an interesting one, and it has to do with getting a surgery in Mexico. And here's a great channel, Living Overseas TV, and a wonderful gentleman who was so kind to share his experience getting surgery. And I want to just view this from the lens of a physician. Let me also give them a little thumbs up for doing this video. I wanted to just comment on this video from the lens of a physician myself and what I do for my patients when they have to get any kind of surgery or anything. And in this video, this gentleman is going to talk about the insurance that he had that covered him, how much he pays for it, how he initially got diagnosed with this hernia, how much it cost him to do the surgery. And I'm going to talk about what it might cost you in the United States to do that. The reason I do that is because the United States is generally going to be one of the most expensive places to get healthcare. But if you know where to do it at and how to shop for prices, it's still a great place to do it. And in fact, I think you'll see the prices are going to be pretty competitive. But more importantly, I kind of want to help you think through any kind of process, procedure, surgery, intervention, lab tests, anything that you're going to have in the future, how I approach it and what I think about it, and how best to arm yourself with knowledge so that you can communicate with your clinicians and staff and the staff so that you can get the best care at the best prices. So here we go.
In the United States, the average cost of an inpatient hernia repair surgery is $11,500.
So this is an inpatient hernia repair surgery. It's important to say that quite a lot of hernia surgeries, especially like inguinal, which is in the groin, or umbilical, which are the two most common ones, can very easily be done in the outpatient setting, which means in a surgery center. And the reason we do it there is because it's cheaper. It's much more expensive to do it in the hospital. There's a lot more requirements of the kind of people that have to be present. The operating room is just more expensive to operate. So the price that he's quoting is definitely correct, $11,000, but it can be a little bit less if you do it in the outpatient setting, so in a surgery center, which a surgery like that can be done. Not all surgeries can be done in a surgery center.
I met with Kevin to discuss his experience of having the same procedure in Mexico.
I discovered, unfortunately, I got a hernia at some point that was there for probably a few weeks, and I realized I should do something about it. So I contacted a local doctor, one of our neighborhood doctors. It's not one of the fancy American style versions. He actually only charges 100 pesos for the initial consultation, and any follow-up consultation is literally 20 pesos.
So this is a very good example of how much it costs to get care in countries such as Latin America, let's say Thailand, Philippines, Vietnam, and Mexico. These are kind of the classic destinations that a lot of Americans go to. Now, I know many of you are in different places. You're in Europe, you're in Eastern Europe, you're in Russia, you're in China, you're in Hong Kong, and lots of other places, Tehran. Obviously, I'm just giving you some examples, but this is very competitive pricing, and you can get very good physicians at these prices, especially when it's for something a little bit more simple. This is obviously a general physician that he went to,
which is like $1. And he checked it out, and he said the best thing to do is to go for a ultrasound. So he made an appointment with a local clinic here that does ultrasound and scans, and the ultrasound ended up costing 700 pesos, which is I think around 35.
I want to stop right here because in general, for when I as a primary care doctor, and by the way, I'm a primary care doctor, I'm a family medicine doctor, Dr. Mo, hello, welcome to the channel. When I suspect somebody to have some sort of hernia, whether inguinal, hiatal, or umbilical, some of the more common hernias that we encounter, usually I already have a pretty good sense, and it's not necessary for me to confirm it with an ultrasound. In general, I will refer to my network of competent and capable physicians, specifically surgeons who can repair it, and even those surgeons can usually diagnose it and do the surgery without having to do any kind of testing. So I just wanted to throw that out there. for anybody who wants to go through that process pretty much as smoothly as possible without having to spend extra money and headaches and testing for things such as an ultrasound.
It was really easy. It was basically a 15-minute procedure. He diagnosed it as a groin hernia on my right-hand side. And so basically I took those results back to my local doctor, and he suggested I contact a specialist to understand what I need to do if I need to have surgery. At that point, I contacted a local hospital coordinator. Her name is Pam Thompson.
So this is wonderful. Definitely this individual, I think his name is Tom, was able to reach out to Pam Thompson, who's a hospital coordinator. Especially if you are dealing with a higher end hospital, these hospital coordinators are wonderful people who can just help you navigate the entire system. And when in doubt, I think, and when you can afford it, of course, it's always good to just go through the process that they tell you. If they say you should get an ultrasound, and it's something you can afford and it's not a lot of harm in that, I think that makes a lot of sense. So he was diagnosed with a groin hernia, which is what we call an inguinal hernia. An inguinal or inguinal hernia generally is not something that you have to operate on unless it is unsightly to you, because it is a bulge, and for some men the hernia can actually come into the scrotum, and so that can be not always uncomfortable, but sometimes you'll have just a larger bulge in your underwear, and that's something that you can sense or you can have some discomfort. Not all hernias have to be repaired on. Some hernias are more problematic because they're, especially the small ones, they can get constricted in that space, and that usually will present with a lot of pain, nausea, fever, vomiting. You'll kind of know that something's wrong in that area. But larger hernias usually don't need to be operated on, and there are even things that you can wear. There's special type of underwear that you can wear to push the hernia in. So if you chose not to do surgery, that's certainly an option.
And she suggested I go see a gastroenterologist, and she made the appointment. She made all the necessary arrangements. Pam actually gave me the blood work form where you get all the necessary blood work.
So in the United States, and I believe also in Mexico, it's usually a surgeon, not a gastroenterologist, who would do the corrective surgery, though it is possible that he went and saw a GI doctor who then referred him for the actual surgery. But it is, even though it is a gastroenterological thing, it is a general surgeon who will usually do this kind of surgery. Some surgeons specialize in this, so they only do hernias. Some colorectal surgeons, for example, may advertise themselves to be experts in doing hernia repairs.
Required for the procedure. That I did at a local little laboratory here in Old Town, and it came to the equivalent amount of $35. So those are the results that when I went to see the gastroenterologist, he reviewed all that paperwork. The visit to the gastroenterologist was around 800 pesos. One other step that's required, at the time, they required a CT scan of your lungs to determine if you have COVID.
So let's go over some of this stuff. So there was a blood test that was requested, and he was also requested to have a CT scan. I suspect this was during the pandemic times, and so they just wanted to make sure that he didn't have any active infection. The prices that you saw for a specialist is quite appropriate. You pay somewhere between $20 to $80 to see a specialist in the private setting, and you probably pay around $30 for an ultrasound, about $60 to $100 for a CT scan, about let's say $150 to $500 for an MRI. These are all pretty standard prices in most of the countries where healthcare is quite inexpensive to begin with. However, again, the blood test is not something that is required, even if he's in, I don't know how old he was. I believe he mentions that he's in his late 40s when he had the surgery. If you're otherwise healthy, competent surgeons, competent doctors, even if an anesthesiologist has to be involved, are not going to ask you to do any kind of EKG, blood test, CT scan, ultrasound, stress test. All the things that we're accustomed to in the health insurance model usually are not required. They're just, I don't want to say they're ways for the system to make more money, but they are considered a little bit wasteful.
And that cost 1,200 pesos. Along with that, I also went for a assessment at a cardiologist, because if you agree to have the surgery, you need to prove that you have a good heart and that you can go through with the procedure. So that ended up costing around 1,000 pesos.
So again, just to have such a simple hernia surgery repair, I think having to go through all these different specialists and see so many people and get the tests, I think this gentleman is making such a nice job of, he obviously wasn't bothered by it, but a lot of my patients, I think it would be quite time consuming and a bit maybe frustrating seeing 3 different specialists and then go to get the surgery, and then many other things. Actually, you'll see in the video other things are coming up that, to me, I think a lot of that can be avoided and there can be a lot more cost savings, but a cardiology assessment is not necessary if you're not at risk for any kind of cardiovascular condition, especially for low risk elective surgeries such as a hernia repair.
To go see the cardiologist. And so that's the cost basically for the pre-operation procedures. Once you get to the point that you agree and you're going to go through with the procedures, you basically just have a final consultation with the gastroenterologist. My doctor was English speaking, yes, Spanish, but English speaking as well. He will walk you through the process. He will talk you through what to expect. The clinic that I went to is incredibly well set up. I would consider it first world standards of medical facility. And you're basically greeted by a nurse, and they prep you, they take you to the room that you're going to be staying in, and they prep you for the pre-op. The doctor comes in and consults with you, and they dress you up in the gown and all the rest of the procedures, and then they take you off to the anesthesiologist. And from there, you basically don't remember anything until you leave the operation, the surgery. My stay was incredibly comfortable. In fact, the room felt like it was a hotel room to me.
So that is pretty classic. And as we hear that a lot from patients, is that their experience is just wonderful. And especially in these private settings where they do a really good job of making you feel comfortable. However, once again, there is almost never a need for these kind of surgeries to be done in the inpatient setting. Even if they're done in the inpatient settings, it can be a same-day surgery where you basically just go to a pre-op area. You're prepped, the area is shaved, the area is clean, somebody's talking to you, they check your vitals, they might do some initial blood tests, they probably will do some other examination of the area just to confirm that nothing has changed since your initial diagnosis. You meet with the anesthesiologist, and from there you will go to a post-op area and then go home. So I think, again, this is not a necessity, and for those of you who ever end up in such situations, it is important to discuss your case with somebody who's knowledgeable in this space so that you are not doing things that are unnecessary or exposing yourself to unnecessary risk. The part that he talked about with English speaking, even if your Thai or your Spanish or your Turkish is really good, I still recommend, if it's not your native country, if it's not your native language, that you take an interpreter with you. If you're not, take a friend. I think that's always the best thing. Even if that person speaks Spanish, another person can hear it, another person can maybe fill in some gaps that you missed. But always, if you can take a friend to any appointment, it's always a good idea, because friends can step in, ask questions that you forgot to ask. So it's always a good idea, even if you speak it really well.
I had like a sofa and a recliner and a really comfortable hotel bed. I had a bathroom and a shower attached to my room. It really felt like you were staying in a relatively high-end hotel, and the staff was amazing. Everybody was incredibly helpful, made you feel comfortable. There was bilingual speaking staff throughout the hospital. Everybody I encountered basically spoke English as well. The surgery itself for the hernia, which was on one side, was the equivalent of $5,300 US.
So I do want to stop here and really talk about the price. So technically, if you take a look at the Surgery Center of Oklahoma, which is one of the top surgery centers in the United States that only deals in cash prices, so they essentially do all of their procedures in cash, you can get an inguinal hernia surgery for about $3,870, so about $4,000. So there are some things here about, there might be extra costs involved if you do it if you have to end up being admitted, if there's any complications and follow-up, etc., like that. But this is a great website for you to check out, Surgery Center of Oklahoma, just to get a sense of like how much things cost. And they have a huge list of things. Why should you do this? Because if in the United States you can get the surgery for this much money, and this gentleman was charged $5,300, along with all the other tests and time that he had to spend going and seeing other specialists, it is worthwhile to consider that, because now you can choose and decide, or maybe even negotiate, right? You might have a great hospital, but you can always negotiate with prices. So it's something to consider.
So in my case, I did have medical insurance with a local insurance provider. My particular policy was a $1,000 deductible. It's actually a global policy, so I can have medical procedures or get sick and be covered in every country that I travel to except the US. Doesn't include the US. You can get a rider, which allows you to get medical coverage, but that's a separate policy.
If you would like to see more videos about medical and dental costs or health insurance, please let us benefit from your experience.
Medical coverage, and once I paid that, basically that's all I paid. All the costs of the CT scan, the blood work, the actual consultation with the gastroenterologist, all those I actually got to claim back, because once I met my $1,000 deductible, they actually covered all those other side costs. I'm currently with a company called Vumi. They are based in the US. So your premium is paid in US dollars. Basically, it's a global policy. So as I said earlier,
I'm a big fan of insurance policies in general, and I'm not talking about health insurance. I'm talking about having an insurance product that protects you against a very bad potential financial catastrophe, right? Whether it's life insurance, as long as you have dependents. It wouldn't make sense to have life insurance if you don't have any dependents. Whether it is car insurance, whether it is home insurance, whether it is business insurance, all of those make a lot of sense. But we have to understand that we don't use our business insurance to pay to repair a door that's stuck in our auto mechanic shop, and we don't use our auto insurance to pay for gas or change a tire, and we don't use other types of insurances for day-to-day stuff. We use it for what it is intended, a major catastrophe. The problem with using health insurance for day-to-day stuff is that it drives up the cost. Not only does it drive up the cost, you become accustomed to using your insurance for day-to-day health expenses and health issues. And suddenly, if the health insurance company decides to deny something, you might either be left out not knowing what to do because you haven't learned to navigate the system paying cash, or you might just do something that's not in your best interest. For that reason, I always recommend have a health insurance plan. Absolutely. Get the highest deductible possible, because if you are in a very bad financial situation and you cannot afford things, if you can afford only the health insurance cost, absolutely do that. But almost never will that make sense, no matter how low you are on that financial scale, because the health insurance is designed to get as much out of you as possible and then bill you as much as possible in the future. So you can arm yourself by being a more informed consumer and refuse the blood test, refuse the CT scan, refuse the EKG, refuse the cardiac testing, refuse the visit with the with the specialist before doing the surgery. I mean, you could essentially just boil it down to, if this is a hernia, I don't need an ultrasound, I'll go see the surgeon. The surgeon says I need surgery, and then also discuss, can I wait and not do the surgery, and then go from there. And I think that's going to save you a lot of money, because he will get into the details of how much he pays a year, and he's paying probably about, give or take, $100 a month for his insurance. And when you pay $100 a month and you have $1,000 out-of-pocket expense, things just kind of start piling up relatively quickly, and you also become accustomed to getting your healthcare from expensive clinics and expensive hospitals instead of looking for places where you can do it with cash but still get really good care.
Anywhere in the world except the US is covered. So at the time of the procedure and when I initially got insurance, I was 49 years old. My premium at that time was $1,200 for the entire year, with the $1,000 deductible. I think from what I'm told that your age is a huge factor. I think once you hit 50 or 60 or 70, your premiums are most likely to be somewhat higher. For me, it was $1,200. But for those who do have pre-existing conditions, I think you have to bear in mind that the medical coverage here is going to be reasonable, but it's going to be that much more expensive.
This is probably something to pay attention to. Any insurance product that you get, remember it's a business. In the end, they can deny your coverage. You could go in for an ICU stay for something and they can deny it. The details matter, and you need to read your contract, and you need to be willing to, or possibly have to, go toe-to-toe with the insurance company, even if they're located in the United States. And I say this because it is, going back to what I said, it is better for you to arm yourself with the knowledge and tools to negotiate your own day-to-day healthcare expenses, including a surgery like this, by paying cash to the physicians and surgeons and staff that take care of you, as opposed to be accustomed and get used to only using your health insurance product. Because if a pre-existing condition exists as you get older, and many other things that come up in life, you may no longer be able to afford those health insurance premiums, or they're going to become so costly that it actually will backfire.
If you have underlying conditions, and a lot of it's case by case, and I would say do your research before you go do any procedures, and make sure you're going to get the kind of coverage that you think you're getting if and when you go for any kind of.
Yeah, wonderful video. Again, this is Living Overseas TV. Wonderful that they share such information with people, so I highly recommend checking out their channel. And again, if you have any questions, if you want more details, just reach out, leave a comment below this video, and I'm happy to answer any questions. As always, try to be your own best advocate when it comes to your healthcare, and stay healthy.